Welcome to Lesson 6 of the EFN Digital Skills for Nurses course. In this lesson, we will delve into the crucial topics of resilience and crisis management within the context of digitalization. This lesson primarily relates to core competency 4, which involves the independent initiation of life-preserving immediate measures and the execution of measures in crisis and disaster situations. As a nurse, this competency is vital for your ability to respond effectively in times of crisis. Over the years, and since the time of Florence Nightingale, the nursing profession has always been considered a profession at the service of citizens and patients. The altruism and the constant commitment to protect and to take care of the community that nurses demonstrate is especially noticeable in times of war and health crisis. Indeed, in these moments, nurses continue to care and provide the best quality care possible without hesitation, even while putting their own lives at risk to save the lives of others. As the majority of the healthcare professionals, investing in a resilient nursing workforce is essential to build resilient healthcare ecosystems able for facing future crises. Being prepared means investing in nurses, in their training and in improving their working conditions. COVID-19 has demonstrated the unpreparedness of the healthcare systems to face sudden crises like the one in 2020. This unpreparedness is due to the lack of nurses who are abandoning the profession massively due to precarious working conditions, low remuneration, and poor attention to their psychophysical well-being. Investing in new knowledge is just as important as investing in frontline resources. The concept "we were not prepared" raised in 2015 by EFN regarding the experience of the Ebola pandemic has proven to be still relevant during the COVID-19 pandemic. In light of what we have experienced during the COVID-19 pandemic, we can say that the road to strengthening health systems is still long. In this context, the essential work of frontline nurses has emerged even more. The COVID-19 pandemic has in fact demonstrated the essentiality of nursing staff for the provision of quality care and the functioning of healthcare systems even in times of crisis. Furthermore, what has emerged is also the need for new knowledge and skills which are more necessary than ever on all fronts, from the production of vaccines to the epidemiological, economic, social and organizational dimensions of coexistence and response to high consequence infection disease. We can say that the COVID-19 pandemic had devastating effects on both citizens and healthcare systems in the EU. Among the categories most affected by the pandemic, we have the frontline nurses who have suffered a drastic decline in physical and psychological well-being due to the deterioration of working conditions with insufficient human resources and inadequate protective equipment. Across Europe, the commitment and dedication of our frontline nurses, risking their own life to save the lives of so many citizens in exceptional difficult circumstances, has been recognized. In this regard, it is fundamental and necessary to recognize the commitment of nurses every day and not just in emergency cases. Ensuring them the right protection and safe working condition is essential for the proper functioning of healthcare systems and for providing timely and high-quality care. Therefore, having a qualified and competent nursing staff is essential to ensure adequate, safe and high-quality care for patients in all healthcare settings. In this regard, the EU Directive 55 represents one of the most essential competencies for nurses. Indeed, this EU directive demonstrates that in their education, nurses learn how to manage emergencies and crisis situations such as COVID-19. As the directive shows, one of the most important competencies for nurses is to independently initiate life preserving in crisis and disaster situations. All of our nurses in the EU are prepared for crisis management. As we all know, nurses represent the majority of healthcare professionals, working alongside patients 24 hours, 7 days in a row, 365 days in a year. Additionally, nurses have a critical role in frontline coordination of healthcare and influencing and empowering patients and citizens. According to what was demonstrated by EFN in 2020, the resilience in healthcare systems at European level strongly depends on the flexibility and professionalism demonstrated by the nursing staff in providing and guaranteeing care to patients regardless of all the risk and negative implications they may have on nurses as being infected themselves and burnout. Therefore, we can say that nurses play a fundamental and indispensable role in the provision of safe and quality healthcare, as has been demonstrated even more in times of pandemics and health crises. The COVID-19 pandemic has shown that there is a need for greater EU support for frontline healthcare professionals when such health emergency occur, and for greater investment in these resources to ensure that care is delivered without hitches even in times of sudden crisis. EU citizens need policies that protect frontline staff from overtime and ongoing staff shortages. In fact, the lack of nurses has been a known problem for many years now. It creates an overload on nurses who decide to remain in the profession and has negative effects on their psychophysical well-being, putting their health at risk. What we have experienced during the COVID-19 pandemic throughout Europe has drawn attention to the need to have strong, resilient and prepared healthcare systems to deal with sudden crises and pandemics. To do so, it is necessary to invest in the support and protection of frontline nurses who every day work in precarious conditions to ensure the provision of quality care for all citizens and patients. In this context, it is necessary for the European institutions and national governments to promote the coordination of health emergencies and ensure that EU can act in a coordinated and uniform way across all EU countries. Coordination and collaboration with nurses and all other healthcare stakeholders is an essential starting point for improving frontline preparedness. This way, all EU countries would be much better prepared for the next pandemic health emergency. Furthermore, the contribution of nurses is important in addressing and solving problems on the front line. They know exactly what the situation is and what aspects need to be worked on to develop effective and efficient solutions. In this discussion, digitalisation is a key point. From a healthcare professional's perspective, digitalisation and artificial intelligence could have a great potential for supporting nurses in their daily frontline job. What is necessary is to create digital tools which can really help and facilitate nurses and other healthcare professionals' working life. Of course, this is possible only by engaging nurses in co-creation. Nurses really know what the healthcare ecosystem needs and where digitalization could be helpful and essential for achieving better health and care outcomes. The creation and the designing process, starting from the conceptualism. No, ripeto questa frase ultima. Deploying artificial intelligence to improve the healthcare outcomes implies involving nurses in all the creation. Deploying artificial intelligence to improve the healthcare outcomes implies involving nurses in all the creation and designing process, starting from the conceptualization. Thank you all for following Lesson 6 and see you in Lesson 7, which will give you an overview on the quality assurance in digital health nursing.